First of all, we now already have a quorum, so I now call the meeting to order. Since the last meeting, the administration had issued the following papers. These are the items with the follow-up items we required of the administration. You may refer to CP 4158/2022-1. I'd like members to note that when we invite the deadline for submission of views from the public, as of the date of the deadline, we have not received any views from the general public. I'm sure members already represent, the views of many members of the public. I will now ask the administration to first of all walk us through the brief, and then members can follow up briefly. Does the clerk have something to say? No? Or if not, then I will continue. I will now. Yes. Everything in order? Can you WeChat WeChat me if there's any problems? Now, first of all, I'd like to invite the administration to walk us through the paper, and then members may ask questions. In order that we can arrange for members to speak in an orderly manner, I would like to ask members to first of all cancel their hands up mark. So all members may now raise your hand to indicate that you wish to ask questions. Now, could the administration now walk us through the paper? Thank you. We have received from the clerk of the council a letter, and we've already replied to that letter. And I'll read out the letter, paragraph by paragraph. First of all, regarding the mainland experts, in order to implement, regarding the views regarding universal testing, the experts have not just come to Hong Kong to advise us on universal testing. The expert panel from the mainland have also had a lot of discussions with us regarding the epidemiological studies and treatment protocol. There's been a lot of detailed exchanges, during the course of which we've also touched on the question of the matters we need to pay attention to in the event of universal testing. And secondly, the emergency regulation and follow up on that. The CE in council, after approving that amendment, we now have the legal basis in respect of the different, anti-epidemic measures the Chief Secretary may follow, taking view of the recommendation of the relevant bureau and the urgency of the project, will provide for exemptions. For example, for the loop area in Lok Ma Chau, and also the segregation facilities, and also for premises outside of the care homes, such as in sports stadium, to exempt the requirement for licenses in relation to the care of the elderly. The CE has already set up 5 task groups to lead in the different areas of work. The FHH, which is responsible for the expert panel. The CMAB is responsible for the enhancement of the anti-epidemic methods. Development Bureau will liaise with the treatment facilities. The Commerce and the Economic Development Bureau is responsible for the task force for logistics and materials. The Transport and Housing Bureau is responsible for the task force in relation to supplies from the mainland and liaison with its mainland counterparts. And also prevent the participation by civil servants in the fight against the epidemic. whatever the departments and whatever the rank of the civil servant concerned, they will be, well, the ship will be on standby to help with the anti-epidemic work. If, for example, in testing, contact tracing, and also increasing the number of premises for vaccination facilities, and also managing the segregation facilities, ensuring the supply of foodstuff and so on, and also relaxing the procurement of medicine from overseas, and also the registration of such medicines. One important support we have obtained from the mainland is in respect of proprietary Chinese medicine. With the support from the mainland and that of other organizations, we are able to obtain such proprietary Chinese medicines, which are steadily coming on stream to Hong Kong. We have, based on the Traditional Chinese Medicine Research Center, and whether it's through the HA or the community facilities, we will distribute such proprietary Chinese medicine to the public. We have also noticed that there's a very keen demand for antipyretics, and we've already liaised with different suppliers and manufacturers, and also the community pharmacies and drugstores while there is a temporary shortage of such medicine, we hope that they will increase the supply through different channels. Regarding the RAT reporting platform, the Department of Health already announced yesterday that the platform has now been commissioned, and members of the public may now register to that platform now. It is now time for questions. Since our meeting is conducted through Zoom and video connection, when the time is almost up for the members who are speaking, you will see the countdown, and when your time is up, there will be an alarm, and at which time I will ask that member to stop. I will now read out the priority of members who will speak. We have Kong Yuk-fun, Kong Yisha, Edith Report, Wang Yunshan, Yo Tak Kan, Teng Fei, myself, Kan Wei-man, and Leung Chi-wing. Each member, I suggest, will have 4 minutes. Madam Kong Yuk-fun. Thank you, Madam Chair. I have several questions regarding the isolation order. The Secretary, I think I've read on the website that many members are very confused about the isolation order, whether it's 7 or 14 days. Many members who received this isolation order on the 7th of March, they still have to be isolated for 14 days. Although on the website, it said that if they are tested negative, it's all right. Could the Secretary clarify that point? According to Cap 599, I think one could actually isolate at the isolation facility or at home. Secondly, the date is so important because it would affect the employers giving sick leave to the employees, because they don't know whether they should grant 7 or 14-day sick leave, because 14 days would even be longer than the annual leave of the employee concerned. Some members of the public also told me that if the government officials, I said, if you don't go to these facilities, it will be a breach of the law. We have DOJ present at the meeting. Under 599A, where does it say that if you refuse to go to this isolated facility, it would be a breach? The ordinance will say that once you are there, you are not allowed to go in and leave. Many people have also said that in a typical household, you have young people, the young and the elderly, and the household. I think how how would they be able to take care of the children? I understand there is a platform for reporting. Now, let's say somebody takes the RAT. Can they not, report the testing results? Would that be a breach? Otherwise, the public will not know whether or not they should report. Undersecretary, thank you. If I heard you correctly, you've asked 4 questions, 3 of which may be more relevant to the Department of Health, and I'll invite the department to answer the question. That is in respect of 5998 and the registration platform. Your 3rd question was that when some families, because of the circumstances or due to other factors, where should they be taken for community isolation? At the moment, I think the latest arrangement is that we have 20-odd community isolation facilities. So the procedure for allocating the people to these facilities is under the purview of the Security Bureau. So through different channels, I think they will be allocated to these facilities accordingly, but I will not be able to give you the details. I'm sure there would be, consideration for individual circumstances. The Department of Health, regarding the isolation order under 5998, there are several parts on that. First of all, the infected person has to be isolated at certain premises. Under Section 25, the person to be isolated would not be allowed to leave the premises until they are no longer infectious, and at which time it will be replaced by medical surveillance. On the 599 IT platform, the isolation platform is for the convenience of the public. If we have a large number of reports for registration, the isolation order also spell out the different premises or facilities for isolation. Now, given the incubation period, normally the isolation period will be for 14 days. Earlier, we have said that if people have taken 2 jabs of the vaccine, then on day 6 and 7, if for 2 consecutive days they take the rapid test, which the result of which is negative, they will be deemed to be no longer infectious, and therefore the isolation order will automatically be cancelled. Under 599A, according to 599A, the person is considered no longer infectious, so the order is cancelled. And the isolation order, on the one hand, should be convenient for the public to register and to enable us to deal with such a large number of registrations.
Okay, so next one, Michael Tian. Mr. Michael Tian, please. Am I coming through? Yes, very clearly. Well, Undersecretary, the most important part about fighting the pandemic is to ensure that for those who have not taken the full vaccination, in particular the high-risk elderly, they will have to be vaccinated. With regard to the Paxlovid, that is the new drug against the pandemic, I was asking why you procured it and yet you're not using it. But then you told us that it's not effective on every patient. But then apparently you haven't got the first delivery yet. So what about the first batch of the drug, and how many doses have you got? Would that be adequate for those over the age of 60 and yet they have not taken the full vaccination? So would that be enough for all of those? And secondly, I asked whether or not within this month for all the care homes, over 1 million elders who are not suitable for vaccination and they have not yet been confirmed to be positive, can they be vaccinated within this month? You promised that you'd do it. because only if they are fully vaccinated, it will be okay. But then for Sinovac, it takes 3 months, and then for Comirnaty, it would take 6 months. So we only have 3 weeks to go in order to reduce the mortality rate. Can you convince all those who have not yet taken the full jab, so that within 3 weeks, all the elders will be able to have at least 2 jabs of Sinovac? All right, Undersecretary. Thank you. Thank you, Mr. Tian. Well, last time when I responded to you, I was just giving you a brief overview about the newly developed oral medication, so that before the onset of symptoms or during the early days of the symptoms, if you administer that, that would also help in reducing the mortality rate. And the hospital authority has already experimented with the use of that. It's not the one from Pfizer, correct? And then for the new drug from Pfizer, because they've only managed to get the approval from the FDA earlier on, and therefore, in terms of the timing, they would only come later. We are still negotiating with them, and it will take time before any agreement is reached. But then, according to what I said, through the HA channels and also through our liaison with the distributor, we would hope that they will come early, so that before early April or end of March, they can come so that they can be administered on patients. What about the number of doses? I don't have the information with me right now. And for the time being, I'm not able to give you all the details, but then they are coming. But then would that be enough for all the over 60-year-old in Hong Kong who have not yet been fully vaccinated? Well, you will have to make a projection. So we also have to have the treatment protocol, whether or not it should be administered on who and how much would be needed and so on, about the age profile and also certain pre-existing conditions and so on, because there might be contraindications and so on. And therefore, we will have to take that into account. And together with vaccination, well, for the elderly population, we will have to go to the care homes to do the vaccination. We'll be speeding up the pace of it, and within a couple of days, other than those that have been doing it, that is, other than the 5 locations, we have also increased the number of vaccination centers and so on, whether or not it's in multi-scene and so on. So can you convince them that, for BioNTech, can that be done within 3 months and so on? Well, for healthcare professionals and experts, to reduce the onset of severe illness and also mortality, well, you will have to enable or allow the antibodies to be fully developed, whether or not it's Sinovac or BioNTech. Well, they should do the job in terms of invigorating the production of antibodies, and therefore they are useful and effective. But then for BioNTech, there can be 2 doses in 3 weeks. Can that be done? Well, what we are doing is that for the first and second jab, well, for Sinovac, we have already reduced the interval so that that can be taken in 3 weeks. So the interval between the first and second dose can be as little as 3 weeks. So Michael Tian, you will have to wait for the second round. I'll allow you to ask further follow-ups, because as we know, for BioNTech, the efficacy is higher because we are talking about saving lives. Undersecretary, well, in simple terms of both vaccines between the first and second jab, it can be as short as 3 weeks. We have already shortened that. That is already happening. Okay, next, Elizabeth Scott. Thank you, Madam Chair. I'd like to follow up on this issue. First, as we know, for care homes, this is a disaster zone, and therefore, I understand that there is this problem of vaccination. Just now, the Undersecretary said that additional teams have been set up, and about 100 more people will be doing the job. But then, within how long will you be able to complete the job so that all care homes, elders can be vaccinated? Because that's very important. Only after you have taken the first jab that you can take a second jab. If you're not able to take the first jab, then you'll be very risky. And also, there are a lot of confirmed cases in elderly homes, and they are staying with those who are not yet infected. And therefore, as a result of that, many more will be infected. And therefore, what we are trying to do is that priority should be given to those who have been confirmed, and then they should be moved out of the care homes. So do you have facilities, for example, at the mobile cabin hospitals, can they be used to take care of care home elders who have been confirmed? And also they should not be staying in the elderly homes anymore. That's the most important thing. And also a lot of resources are coming from the central authorities, and whatever you ask, they'll give it. So in terms of the resources, where have they gone? Has there been any coordination, and how are they distributed? Because there are shortage of resources, because we have also sent some resources to some of the care homes. They said that there have been shortage of N95 masks and so on. And also for the fast test kits, there is not adequate. And also in terms of PPE, they don't have enough, and they will have to take care of confirmed positive cases, and they are also bound to be infected as well. So how are you going to deal with that? And also for private hospitals, last time I already said that you will have to mobilize all the private hospitals in fighting the epidemic. So what have you done so far? So there are 5,000 beds available in the private sector. How many will be used to take care of those who have been confirmed positive? And have you asked any private hospitals so that the entire hospital can be used for taking care of the confirmed cases? Because we have more and more such patients. They are staying home, and they are also denied medication. We are not able to provide them with medication either, because we are not able to buy them. So how are you going to help them? The Secretary. Thank you, Madam Chair. For elders, and also for those that are staying in care homes, and also the vaccination program for them, as far as I'm aware, there is already this matching program, so that within the next 2 weeks or so, according to the number of residents in care homes and so on. So we have already come up with a program, so that if possible, in a matter of 2 or 3 weeks, we should be able to complete the entire vaccination program, so that all elders in care homes can be vaccinated. And also for elders who need to stay outside of the care homes, because their conditions might be very poor, and therefore they might not be taken care of at care homes, because they need to be under surveillance. Then I understand that for community isolation facilities, if you look at what they have and their equipment, they may not be able to meet the needs, and therefore we will have to consider that further. With regard to the provision of resources and daily necessities, so the Chief Executive has already appointed the Secretary for Commerce and Economic Development, so that he will take charge of the distribution of resources to those in need, and therefore he'll do the coordination, and all the resources will be distributed via different departments. And as far as I understand it, if there is any shortage of resources by any care homes, they can inform us, and then we will look at what they need, whether or not is the distribution process, or whether or not the total number is not adequate, and so on. And also for private sectors, how they can help us in fighting the epidemic. Well, we have been in constant negotiations with them. So number one, they can help us with admitting the non-acute patients from public hospitals, and also those with mild symptoms. We have the system in place. We'd like them to increase the capacity. And next, for those who are going to the outpatient clinics or departments, they can also go to the private clinics, and if they say that they have fever, or if they have been tested positive, if they need the advice of the doctors, or if they need any medication, I understand that they are also discussing amongst themselves. And third is about admitting confirmed patients. Well, as you might be aware, the Chinese U Medical Center has already said that they would be admitting some 20 plus confirmed patients. So we are negotiating with them to see if they can admit more. Well, Undersecretary, do you understand, if you have confirmed patients staying in care homes, is really very irresponsible, because they are bound to infect others in the same care home. So you will have to identify a hospital so that they can all be moved there. Even for patients or elders who have no symptoms, they can also be infectious. You're still negotiating, but then it's a very critical moment. We are talking about lives and deaths. So how come you're still negotiating? And even yesterday, the Chinese U Medical Center only said that they would be prepared to set aside several dozen beds, only 24 beds. So to what extent can they help? So you should mandate that they should give you more beds. It should be a requisition, because there is simply no time for you to negotiate. Secretary, can something more positive and proactive be done, taking on board the views of the members, because they're actually at the front line, they are rushing there to help. So indeed, they are taking this very seriously. So only 24 beds, that's the number that we got. We are very precise these days. Okay, so we hope that other lawmakers can also follow up on this. Next, Mr. Wong Yun Shan. Well, Undersecretary, thank you, Madam Chair. I'd like to follow up on what we said last time. It's about the private hospitals. And I can see that the response is that they're actually passing the buck back to the court of the Bureau. And they are saying that the Undersecretary, the Secretary, and also the Bureau should be more proactive in mobilizing them. And I'm very concerned for you. I understand that you'll be more firm in rolling this out. But then specifically, I have the following questions. Number one, Undersecretary, I read the newspapers and apparently there were reports saying that if you look at the epidemic as to the number of confirmed cases in the community, do you have any projections? So roughly speaking, how many people are there who have been confirmed? According to reports, about 20%. So we're talking about 1.4 million. So do you have these specific figures? And next, out of the confirmed cases, how many have to be admitted to hospitals? Well, according to Singapore, it's 1.3%, and in the US is 2.7%. So in Hong Kong, what about the admission rate? To what extent should they stay in hospitals? Because we are talking about 8,000 beds. And there are some 8,000 patients in public hospitals. So as far as you are aware, what is the actual need? The reason why I'm asking this, that's because for community isolation facilities in the paper, you've also touched on that. And just now, we've been told that apparently they are not able to really support elders from care homes because many of them have chronic diseases and they've been confirmed. And therefore, they have to be sent to isolation facilities and they will need a lot of healthcare professionals to take care of them. And if we are short of that, Undersecretary, can you tell us a bit more about what you're negotiating with? What are the considerations? And also, on different locations, can you get more help from the mainland authorities so that for our mobile cabin hospitals and also our community isolation facilities, we have to have enough manpower to take care of them? Because as we know, for the hospital beds, they are simply not adequate.
Secretary, thank you, Madam Chair. Regarding the estimate projection of the number of infected cases or confirmed cases, I understand the government experts already made some estimates. At the press conference of the Center of Health Protection, they said that some people who took the RAT have not yet registered online. Now that the website has come on stream, they would through that platform they will be able to get. They will be able to let us know how many confirmed cases there are in our community. So these are reference numbers. As for the capacity of hospitals, one of the direction, I think one option is to deploy the resources which are being released. The HA has already have designated hospitals which specifically focus on accepting, COVID patients like, Tin Shui Hospital and the North Lantau Hospital. They need more hospitals to admit the non-emergency cases and the non-COVID patients. In answering the question by members earlier, I think I've already touched on this. As for medical personnel, we are in a very tight situation, whether we're talking about looking after patients in hospitals or at the AWE or in the community, treatment centers. the government has actually asked the mainland to, to provide us with more medical personnel to render such services. Secretary, do you understand that we are several thousand hospital beds we are short of? I don't understand how that number is arrived at. The experts are saying that we have about 1 million confirmed cases. Singapore, according to Singapore, there are 1.3% of those who need to be hospitalized. In US, it's 2.7%. So between 1.2 to 2.7%. Now, the public hospital in Hong Kong is accepting 8,000 patients. Now, the hospitalization rate is very important. With that number, you can roughly know how much more do you need to do, and do we need to provide for several thousand extra hospital beds? The ballpark figure is that we need several thousand more hospital beds before we can have the resources to cope with the epidemic. We don't have the number, we don't have such a projection, but I understand that the anti-epidemic experts in the mainland are still working together with HA and our experts looking at the anti-epidemic strategy and also how we deal with the serious and less serious cases. I'm sure they'll be discussing all these details now. Undersecretary, we just want you to be more precise. I've read from newspapers saying that we are having, 100,000, number of infected persons, the number is in hundreds of thousands. So I think you've received, I don't think you should not be giving us any numbers. Do you know exactly what is the demand for medicine and also the human resources required to cope with the infection? Mr. Yu, Chu Tek Kun. Secretary, I have one question and then I'll follow up on other questions. Regarding the registration platform, the FST has already set up this platform. The people who reported will be taken to the segregation outlet. Do you know that it is the FST which actually set up this platform? Now, if you have a symptom, why is it that the DH does not provide a link directly to the platform, of the FST? Perhaps I can ask the Department of Health to supplement on this point. Department of Health. Thank you, Madam Chair. The RAT platform is mainly set up to help us find out how many people in the community have taken the RAT and is confirmed positive. That's why we want to set up this platform so that we can know precisely the number of such confirmed positive cases so that we'll be able to triage these patients if they live in undesirable household conditions or if they need to be taken care of by the family members, then we can arrange for these people to go to the community isolation centers. Now, my question is, did you know that it was set up by the FST beforehand, and why you did not provide for a link? Well, I don't have the information to answer that question. What I'm saying is that this platform for registration of positive cases, I think you need to shorten the procedure. Early on, when patients confirm that, I think people find out that they are positive, normally by the time our volunteers give them the bracelet, it would be, 5 or 6 days and they've already turned negative. So I read from the newspapers that you'll be sending people to do the test and going to people's, homes. I don't know how long that would take. After you've taken the test, by the time you take these people to the isolation center, these people would have already recovered. Why is it that you don't have a check system in that platform? If someone say, I have the symptoms, I need to be isolated, why can't you immediately take them to the isolation center where they can still take a PCR test for confirmation? If people report that they are positive, why don't you give them the bracelet and the resource kit the following day? If you're late, then people will throw away the bracelets. if you're worried that the people want to make false reports, well, there is a fine of $10,000 and a 6-month imprisonment. Or you can say on the platform that any false declaration or reporting will mean that the person will be liable to a $10,000 fine and 6 months imprisonment. People, you fill in the detail claiming them to the person to be the CE, we would all know, and you can arrest that person. And in that way, nobody would dare to make false, reports. So the idea of using the technology is to shorten the whole process. If you are tested positive, I would be able to know quickly, so immediately, so I can give you the resource kit and then take you to the segregation center. You now have the number which exceeds $200,000. So how many people do you know you need to actually go to the homes to carry out the test? Thank you, Mr. Chiu, for your suggestions. I'm sure if we want to further streamline, it's a good idea that we further streamline that procedure. The Department of Health announced, or the Center of Health Protection, they announced the launch of this platform and actually, carry out tests at the home of the person. I think the intention is that we have a random survey or check. We arrange for some people who have reported that they are tested positive. It has no direct relationship as to whether or not we will take them to the community testing center. Mr. Tang Fei. Thank you, Madam Chair. Under Secretary, I have several questions. Now, my first question is, in the public hospitals or also in the elderly care homes, for those serious cases, whether they're the elderly, young people, or even the able-bodied, for these people, how long do they have to wait or queue up before they can confirm that they are serious cases and can be taken to the hospital for treatment? We don't want to see in public hospitals or any hospitals outside of which you have long queues and people wait for hours before they are told that they will be taken to the modular cabin hospital and so on. And under the present circumstances, in order to cut down the death rate, we have to ensure that we increase the vaccination rate of the elderly and that the serious cases will get treatment faster. Secondly, regarding the proprietary Chinese medicine and the antipyretics, the Undersecretary, in your paper, you've explained that the proprietary Chinese medicine from the mainland has been actually distributed to the members public through the anti-pandemic, link. Mr. Yeo said earlier that these proprietary Chinese medicine have been distributed to the hospitals. So how can you ensure whether it's the distribution of these Chinese medicine and prescription by doctors, when can they be sent to the people who need such medicine more quickly? Every day, I go to the pharmacies and the convenience stores in my vicinity, I still see no supply of the Panadol tablets. In your paper, you say that the wholesaler is telling us that there is sufficient supply. Would you impose, for example, would you consider restricting the quantity that people can buy these medicine? I've taken a look at the convenience stores and drugstores in different parts of the territory. I've seen that people simply cannot buy the Panadol or similar pyretics. So how can you ensure that there will be sufficient supply so the people who are isolated, in case they have a fever, they will be able to at least, lower the temperature? Under Secretary, regarding the early identification of the serious cases, whether it's the HA, we know that there are now many cases in the community. Other than household isolation, I think they have been sending signals to adults and parents, telling them how to pay attention to symptoms that should be of concern, and if such symptoms appear, they should go to the A&E ward. And these symptoms include shortness of breath, chest pain, changing the color of the skin, and so on. And secondly, the proprietary Chinese medicine. In a paper we dispatched by the Secretariat, it said that the proprietary Chinese medicine has already been distributed to people who are under quarantine. So they're distributed by the HA, the Chinese proprietary Chinese medicine medical clinic. They're also in HA premises. Such medicine is also distributed by other organizations. The Commerce and Economic Development also issue daily news press releases in which they explain that they have received about 450,000, such proprietary Chinese medicine packets, which have been given to people in the community for distribution. Thirdly, regarding the specialist drugs like the antipyretics, I think members of public perhaps they need such medicine, but the Department of Health already said that other than a particular brand, there are other medicine available in the market, which also has the function of lowering the temperature of someone who has a fever, and citizens can also make reference of that. We can also ask the local manufacturers to increase their production. And also, we will be seeking assistance from the mainland to supply such, essential materials. Undersecretary, what I'd like to ask is whether or not you will be prepared to, at this critical time, tell us whether you have a roadmap every day. I think in this fifth wave, more than 2,000 people already died, one of which is a relative of mine. She felt sick last week. They listened to your advice and stayed at home, and then she just died quickly. So what I want to say is whether you are telling people who are over the age of 60 and who are chronically ill, and we're not just talking about serious chronic diseases, but like high blood pressure, would you tell them that it is a very dangerous situation? I know of 6 families where they have members infected, including the 7- and 8-year-old and those who are in the 70s and 60s living together. Some have recovered. Fortunately, the younger one have recovered, but they are still living together. Those who are infected. Same for the children who eventually also became infected.
So under your public health policy, they have to be isolated, and the purpose is to reduce mortality. We are not asking you to do much. It's just about reducing mortality, because this is a new disease. So you said that you're going to negotiate. I'm very worried. 2 weeks, 3 weeks, how many more people who are innocent and who have to die unnecessarily? So do you know how serious the situation is in the community? They just cannot be bothered to report, because even if they report, you're not going to help anyway. So this is a fact. So over 2,000 families, and this is going to continue. So I'm very worried about this, because they might think that their cases are mild and therefore they just live together, and they don't want to go to the mobile cabin hospitals, because there have been rumors and speculations about these mobile cabin hospitals, because if they can go to those hospitals, that would be good to their families, because we're talking about vulnerable families with young kids. And you said that, the person who died, he's just 60. Is not he's not very old. He didn't really have chronic illnesses, but then I just heard about this case. And therefore, I hope that Undersecretary, you've already invoked the Emergency Regulations Ordinance. So Why can't you just ask private hospitals? Because for all I know, they hope that they can have proper treatment. And also, they hope that they can be given sound medical advice because they are just staying home. They are just relying on themselves. And even for those who are very knowledgeable, they are also staying home. So why is this happening? Because there is a lack of coordination. I've also received this. Well, we have also heard that, Mr. Ho Xiu Wei, he's the chairman of the Private Hospitals Association. He said that he had been aggrieved because he had never got any request from you that private hospitals should also admit COVID patients. Okay, this is what I got from him. And then there are 13 private hospitals, 10,000 TCM practitioners and 9,000 Western doctors, and also over 10,000 nurses and so on. So these mobile happen hospitals are ready. Why can't they go there? That's because they have to be taken care of by professional healthcare staff. So they are waiting at home, and they'd like to be properly taken care of, or else their symptoms can be mild now, but then they can become serious, and then they could eventually die. So the first thing that you need to do, given the fact that you've already invoked the emergency regulations ordinance, why can't we have personnel from the mainland to come over to help? And also for private hospitals, have you actively talk about requisition, and also have you discussed with them about the system and how it should work? It's not just about the hospitals. For example, for people who are resistant to mainland manpower, then why don't they just go to the front line to take care of those who are ill? So for those with mild symptoms or no symptoms, they all need to be taken care of. Michael Tian was right, because for people who are over 60 and they've just taken the first jab, they never knew that it's so dangerous and they could just die right away. So have you known anybody like that? I've repeatedly said this. I don't want to say that anymore. But the thing is, for people that I know, well, many are very respectable, and many of them have been infected already, and they don't want to bother you because they understand that you're already having a headache. And they said that they are all relying on their own means. So the emergency regulation ordinance is already there. There is no need for us to enact any new legislation. So all you need to do is to invoke it and use it properly instead of just considering it. So once again, I'd like to repeatedly ask you, because even for professors, they are very worried that elders in their homes might not be able to overcome this. So I also have elders at home. I don't want them to succumb to the disease. So can you just mobilize the medical staff so that at least half of the private doctors can be coordinated so that they can be mobilized to take part in this fight against the epidemic? Undersecretary, can you do something about it? Madam Chair, thank you for your concern. So you're trying to ensure that people will not get from bad to worse. In fact, this is what we are facing, and this is also what we are doing. And scientifically, the only thing that we can do to prevent people from getting from mild symptoms to severe symptoms is to have this oral medication. And according to the study, in the early days of the onset of symptoms, if you can take that medication, then that would help. And that's the reason why we have introduced this drug, and we are doing that already. Michael Tian, he'll be asking that in the second round. But then the thing is, we have not been able to precisely do it. And you said that in 2 or 3 weeks, but then many people will pass away during that time. Many of them have yet to be infected. And you're going to have people who will get infected because there is an outbreak in the community and they might not be aware of the danger or the risk. And therefore, you will have to do something about it because there is a shortage of medical staff in 2 or 3 weeks. Well, patients might exceed 10,000. We might be talking about 20,000 because for many people with elders at home, they've been asking that you will have to deploy the medical staff. You will have to make sure that they are in place. They have to be ready. Well, they dare not ask for anything else. Well, even for medication, you're not giving them the right medication. So we've been talking about mainland healthcare professionals, and you're talking about private hospitals and also healthcare professionals. You will have to mobilize them because this is a battle. And in 2 or 3 weeks, you'll be talking about large numbers of patients. We're talking about several hundred every week already. And for the 20,000 and so on, they are just not accurate because for the many families that I'm in contact with, most of them do not trust you. They are good citizens. So you will have to do something about it. You will have to reduce mortality. They should not die. And you will have to isolate them. You will have to tell them that they have to be isolated because they are still living with their family members. Some have children, and I'm very, very worried. Well, when the adults recover, and then the kids will be infected and they stay together. Undersecretary, you will have to empathize with the situation. You will have to understand what is happening. I absolutely believe that there are many more people who are infected in the community. So you will have to go back and think about it, think hard about this, what's meant by being precise and concise. So if you don't have the figures, then how can you fight the epidemic? Because if you don't have the ammunition, then how can you fight a war? If the drugs can only arrive in 2 or 3 weeks, then elders will die because you're not forcing them to take the vaccination and simply because they trusted you. That's the reason why they didn't take the jab. And you talk about Singapore, how can we compare ourselves with them? Because they've been very decisive. So they have done everything that is necessary, and that's the reason why they've been able to reduce hospitalization. You will have to think hard before you can cope with the situation. Next, Kan Wai-man. Thank you, Madam Chair. All right, today is March the 8th, and 160 more people have died. And as the Undersecretary said, cumulatively, we have over 2,000 people who have died. Undersecretary, what we have heard is that the central authorities have been saying that people's lives matter and everything else would be less important. And therefore, the overriding priority is to deal with this disease. But then according to your paper, you still talk about discussing things with the stakeholders and so on. And also the reply from the Bureau says that you will act in accordance with the established procedures and you will consider procuring more resources from other markets. So I find it very disappointing, Undersecretary. We are not at the 4:30 press briefing on the epidemic. We are lawmakers, we have duties. And therefore, the administration, you have to discharge your constitutional duty. You will have to tell us how you're going to make use of these laws. As the chair just said, today we're looking at 241N. This is what the Emergency Regulations Ordinance has empowered us. So we have the emergency powers available. But then on page 1, you just said that 241N will be used at the loop area in Lok Ma Chau so that the makeshift hospital will be built. And also the Secretary has also exercised the discretion so that the confirmed patients and also the non-confirmed cases can also be isolated at specified locations. But then what else have you done under 241N and also under 241N when we do the cross-by-cross examination, Madam Chair? Well, in terms of transparency, what has the administration done? Because under 241N, this is a legislation by way of negative process. So on the 4th of March, we have already said that it should not be just you coming to this meeting. We'd like to take the opportunity to see what the administration has been doing. You will have to make good use of this center because all lawmakers are very concerned about how we have this top tier leadership. And on the 5th of March, you have the press release. You have already set up this command center since 2020. What does that mean? If you had been able to have that command center working effectively since January 2020, how come we have this sorry state of affairs? And still you're saying that civil servants are ready, they are on standby. But then what have they done? What have they been doing? Just explain to us. And secondly, we've been asking you about the resources other than the CEDB, which have got the resources from the central authorities in the civil society. Many people have been doing this. How come 241N does not exempt them? You are still following the established procedures in procuring the resources and so on. You haven't given us any reply. You talk about 450,000. Do you know how many people have been confirmed? And as at yesterday, we have already got 500,000. So for 450,000 doses, how can that be distributed? You said that 2/3 will go to the public sector and then 1/3 will go to the community. How can that be enough? So why can't you just tell us under 241N, what procedures are in place to let the people know what you've been doing? Thank you. Under Secretary, please. Thank you, Madam Chair. Under 241N, whether or not there are other powers that we have. Well, I don't have other information available with me today. That's the reason why it should not just be you. Well, last time the chair already asked that other bureaus should also come. If you're not able to answer this question, this is the Legislative Council. This is not the 4:30 press briefing. My apologies, Madam Chair. We are all very concerned about the life and limbs of the public. Under Secretary, if you're not able to answer the question, don't waste time. Next one, please. Can you seriously do something for us, Under Secretary? You do have the responsibility because you are, after all, from the relevant bureau, and the figures have to be accurate, or else you simply don't know how to help. Well, people are falling into the sea, and they are looking up to the administration for help. And for private doctors, I've also talked to them, and many of them are very enthusiastic. And still, there needs to be coordination from the administration. You have all the means available. You have all the means available. And well, we have already given you the authority, and yet you're not using it because you have many lives in your hands. Madam Chair, well, you're talking about biosecurity and also lives and limbs. Those are the priorities of our nation. And last year, they've already got this biosecurity law in place so that for major contagious diseases, they are also threat to biosecurity. And we have already got many figures showing that, well, there have been cases transmitted via Hong Kong into the mainland. We're talking about hundreds of those cases. We don't know whether or not it will continue to spread, affecting national security. Madam Chair, you also reminded us, Under Secretary. So do we have the DFJ people here? Well, actually, for those of us in the legal sector, whenever the emergency regulation ordinance is invoked, well, it's an all-embracing legislation, and whatever we need can be done under that piece of legislation. It's a life-saving piece of legislation. So many people are waiting for you to help. You will have to do more coordination because you are from the healthcare sector. Only you will know how to do the coordination. Next, Leung Chi Wing. Thank you, Madam Chair. I'd like to ask 599F. Well, the government asked the administration to use the Leave Home Safe app so that you can track the disease and where it comes from. And yet in the mobile app, you have also cancelled some of the notification functions. So you're actually hiding behind the shield, and you're sweeping everything under the carpet so that we don't know where the confirmed cases are and where they live. So do you have a comprehensive policy so that by making use of the mobile app, so that people will genuinely know where there might be risks, so that you'll be able to have early identification, early tests, and also early isolation and early treatment, so that you can suppress the number of cases, so that you'll be able to achieve the dynamic zero infection policy. And also you're going to introduce mandatory testing. But then for public transport, they still have to operate. But then as you can see, whether it's buses, the railway, and so on, there are many staff members who have been infected. And if we continue like that, without doing something about public transport, if there is no use of the Leave Home Safe app on public transport, then how can you lower the infection risk? Third is about this. I received many complaints lately about eateries that continue to do business, and they said that some of the staff members might be infected. So I don't know whether or not they have not reported the case even though they have been infected, or is it that they are close contacts of the confirmed cases because they are in the same family, or is it that the employers know well that they've been infected and still they allow them to continue to work? So have you received such reports, and can law enforcement action be taken?
Yesterday, you already, commissioned a platform for people who use the RLT and report whether or not they are infected. At the same time, you have the segregation isolation order, But is that also a certificate for the employees to actually convince their employer that grant them sick leave and receive the allowance? Also, the website that you launched yesterday, it will be from the 26th of February to March 5th for people to self-administer tests and report if they are tested positive. For those before the 25th of February, you're using the old platform for the patients to fill in the declaration form. How do you deal with those patients who can obtain the segregation isolation order so that they can obtain a sick leave certificate? So how many people have already reported? How many family members living to them that are involved? And how many people who have already reported? And also for the hotline that you provide, how many staff are manning the hotline? Undersecretary? There are 5 questions, and I will invite the Department of Health to answer the 4th and 5th question regarding the website, the declaration website, and how we deal with the cases before the 26th of February. The member asked about CAP 599 and its relationship with the Leave Home Safe app. I think the app has the advantage because the public has this habit that when they go to places which are crowded or frequented by many people, if they register that they have been there, and if the numbers do not go up exponentially in future, it can actually help make the contact tracing less complicated, so that through declaration through this network, we can actually perform the test. Given the virus is spreading so quickly, and there are many potential cases in different parts of the community, perhaps this function is not really working effectively. That's why we have suspended that notification function. The government will try its best to identify the high-risk areas. For example, sewage monitoring. We have conducted sewage monitoring in many places. If the viral load is high, we will focus our efforts to tackle those areas. At least there are 6 areas where we have already locked down the premises, and we've actually identified at least 10% of those people living in the premises concerned who are infected. So this actually helps us, achieve the purpose of early detection. Regarding details of the universal testing, I don't have anything to announce today. The government definitely will, consider all the relevant details before we make an announcement. Thirdly, if anyone should discover that there are confirmed cases who leave the home and still go to work, this is totally unacceptable. It is also a major threat to public health. If there are any such cases, I think you can report either to the Department of Health, and we will certainly deal with those cases seriously. I will now ask the Department of Health to answer the 4th and 5th question. First of all, regarding the website. The website, which was commissioned yesterday, enables people who have taken the RAT to report their positive test results. This is from 26th of February to the 5th of March. It will be retrospective to cover that period. And from the 6th of March, people can immediately report their cases. The threshold is set at the 26th of February because RAT is regarded as a means to report confirmed cases. For people who've taken the PCR test and found positive and have been notified by the SMS, they will make the report through that channel. For the PCR platform, we have a mechanism to liaise with the people who are confirmed cases and deal with that accordingly. Regarding the isolation order, whether it can be treated as a holiday, I think the Labor Department is now amending the employment ordinance. They will be working along that direction. And I think the bill is already gazetted. The overall direction is to enable employers for employees to be able to get some, assistance. Mr. Young Win Kit. Thank you, Madam Chair. First of all, I'd like to thank the Undersecretary for answering the question I raised at the last meeting regarding the antipyretics. I hope you will, as soon as possible, implement the measures that you told us just now, because so that there will be abundant supply of these antipyretics in the market, and that the patients will not delay the treatment. Secondly, regarding the use of private hospitals to admit, COVID-19 patients, I agree with other members. But if in case the private hospitals refuse to admit these patients, I'd like to suggest whether we can ask the private hospitals to admit all the non-COVID patients so that the beds vacated in the public hospitals will be used to admit the serious COVID cases. Only by doing so can we deploy our resources effectively. For people, therefore, the patient will no longer have to go to the hospital. They can go to private clinics, for follow-up consultation. And the government may set a standard regarding the fees to be charged. That way, we'll have sufficient resources to cope with the epidemic. Secondly, can we apply to the central authorities for the central government to send a medical ship to Hong Kong? We have a shortage of, medical materials, and the medical ship can actually help solve the problem. Thirdly, regarding the new oral medicine, we've been talking about this for a long time. Why is it that you do not try to procure these oral medicine from the mainland as well, because it's available on the mainland? So you don't need the FDA to approve the Pfizer drug. I think the main alternative is also a very good solution. Also, we need to, reduce the number of infectious disease. Can we require people to don PPEs? If they don PPE, people will not be infected, so there will be lesser need for treatment. So that is still one way to reduce infection. The other one is the question lockdown or the restriction testing notice in Tok Wai Chin. Many residents have been tested positive. They are staying at home and nobody is, doing anything to help them. Undersecretary, you're telling us that it's not under your purview, it's under the housing department. Is there one department that should, coordinate the efforts to help these people? These people are staying at home, they don't have any support. Some people, for example, have young children who get the isolation order, but the parents cannot go along with the children as well. There's no point to isolate these young children. I mean, they are forced to violate the isolation order. So I think you need to be flexible. Should you apply the isolation order on a family basis? Undersecretary. I'll answer Mr. Young's second question. Regarding the use of different hardware, for example, the use of OPD in hospitals, we need to look at it globally. We look at the role of the different hospitals and the strengths. The HA will designate more hospitals to treat COVID patients. The public hospitals have more experience, and so if they treat more COVID patients, and private hospitals can deal with other patients, then we can leverage on the strength of the different hardwares in our system. So we need to do better coordination. Secondly, our request, we have put different requests to the central government regarding medical supplies. We are asking the mainland for the supply of various materials. As to whether we should ask for a medical ship to come, we have to think about that. As for the oral medicine, the 2 oral medicine that we talk about, because there are clear scientific studies, and for example, the FDA of the United States have already granted emergency use of such medicine. These are useful reference so that we can import these medicines to help lower the mortality among the seriously ill. To cut down on the risks of infection, I don't think all of us would need to don PPEs. As long as we apply appropriate measures like putting on masks. The Department of Health has been emphasizing this all the time. If everyone could do that, that can help already a lot. Secondly, hand hygiene, don't touch your eyes before you clean your hands. These are simple things one could do. If everyone does that, it will also help. I understand that in the restriction testing notice, every time we finish the exercise, all the residents in the area concerned will have taken one test. If they refuse to take the test, they will be issued a fixed penalty ticket. And then they will say, Secretary, the reality is that the person is tested RAT and found positive. They don't need to take the nuclear tests again. And these are the people that you have neglected. I'll try to find out, more about that situation and come back to you. I think we have a large number of such cases under Secretary. Dr. Lim Shih Yin? Yes, thank you, Madam Chair. First of all, I fully agree with Mr. Yeung Wing Kit. That is, private hospitals admitting non-COVID patients. If there are 5,000 odd beds in private hospitals and 30 odd beds in the public hospitals, if you are 2,000 to 3,000 patients, transfer from public hospitals to private hospitals, then you can release 2,000 to 3,000 beds in public hospitals to focus on treating COVID patients. I think you should consider that. I also agree with the second point made by Mr. Yeung. At this time, family members should play a more active role to take care of the more stable, COVID patients. We've been talking about this for a long time, but you've just heard what we say, and that's it. We all know that elderly care home is a disaster area, high-risk area. Many of the residents are already infected, and those who are not yet infected cannot be segregated, isolated. And many of the staff are also infected, so the home is seriously understaffed. Would you consider for the infected elderly in these homes, would you send them to the community isolation facility ASAP? If these facilities are not enough to take care of these elderly, you can increase the supply of first aid material and monitoring facilities at these isolation facilities. At these elderly care homes, and I'm sure you've considered this, that is, remote, medical consultation may help, because if you stop the infected elderly going around in the community, it can help, cut down the transmission.
But then there are many restrictions that are no longer in line with what's needed. In fact, I've written to you, and also many medical associations have written to you. So can you do something about it? Because during this period, can you relax some of the restrictions so that for those in need, they can also get proper treatment? Certainly, well, for the community treatment centers and also the community isolation facilities, how many TCM practitioners have been able to help? Because we understand that our proprietary Chinese medicine has been developing very rapidly, and they can provide very effective treatment to the patients. So, Undersecretary, well, for elders and also for care homes that are facing a lot of difficulties, we fully understand that. according to the CHP's reports, actually, I think some 70% of the care homes have got residents and also their staff are infected. And therefore, there is also a shortage of staff because many staff members have been infected and therefore they are not able to report for duty. So they are having a very hard time. As to whether or not we're going to introduce imported workers to help, in fact, many have told us that there is this need. We hope that that could also help solve this manpower shortage problem and also increasing more facilities so that for the infected elders, well, there can be centralized facilities to deal with them. And also for the high-tech cruise terminal, that we have this hardware under preparation so that we need more facilities, and then elders can also go there to receive treatment, including Chinese medical treatment. So whether or not we have this epidemic, indeed, we have to have more developments in terms of well, online consultation, because if you consult a doctor face-to-face, it's manpower intensive, and that would also increase the infection risk. According to my understanding, it's not about a particular legislation saying what you can do and what you cannot do. So it's not like that. So for medical staff as a whole, it's about how things can be done given the very emergency situation. So we will have to make sure that both the givers and those being taken care of can be rest assured that there will be little infection risk. We have been using Chinese medicine, and we understand that in some of the community isolation facilities under the HA, they are already providing consultation service by Chinese medical doctors. So that's what we are doing, and we will step up that approach. Next, Mr. Lam Xiu Lo. Thank you, Madam Chair. Well, according to the Undersecretary, and also by reading the papers in terms of distribution or division of labor, is quite clear. And you're also doing all sorts of coordination. So let me share with you a situation so that both the Undersecretary and his team will know this. Well, my institution is responsible for running transitional housing or interim housing. So we have already got a dozen or so cases where people have been infected. We have also reported those to the CHP, and yet it doesn't help at all. Why? That's because, well, for interim housing, on the record, is still a construction site, even though we've already got the occupation permits. So nobody is responsible for that. And there is no formal support from the administration whatsoever. So you talk about, undergoing or imposing restriction testing orders on certain areas and so on, but that doesn't apply to interim housing. I've asked my colleagues to deal with that, and I've also asked my counterparts in the housing sector to see what their experience is. But then if the administration has been doing a very detailed job so that you're doing coordination at all levels, then I might say that this is a very small loophole, but then in the process, while we are fighting the epidemic, it can give rise to a major problem. And if we can see that this kind of loophole, then I really hope that the administration can seriously review the so-called coordination network. Is it that you think it is watertight? I don't think that's the case. And also, as many colleagues have mentioned, there are many good citizens out there. They have reported their infections. Okay, they have been tested positive and they are waiting patiently for your instructions and guidelines as to how they should do to cope with the situation. So I'd like to take the opportunity to ask you, all right, they have waited for 7 days, 6 days, or 8 days, and still they have not received any message from the relevant departments as to what they should be doing. And there is this new platform established. Do they have to report it again? So I'd like to listen to the guideline from the other secretary so that we can tell the residents as to what they should be doing. And my third question is, I believe that the undersecretary should know, all right, for the hotline, I absolutely believe that they are manned by staff, and yet unfortunately, many people still find it hard to get through. So I'd like to know whether or not you're aware of the situation. Are there any improvements that can be made? What follow-up action will be taken when people cannot get through? Undersecretary, thank you, Madam Chair. On interim housing, I might need to find out more from Mr. Lam about the details of what you said, because I didn't get the details as to whether it's about how the case was being dealt with or whatever. But on restrictive or restriction testing notice, does it apply to interim housing? It's not about whether or not is interim housing, whether or not that will be closed off for testing. But then at this stage, we are using the sewage sample testing as the criteria for conducting this kind of operation to close off a particular block or area for mandatory testing. So that will continue to be our approach. And according to the announcement by the CHP yesterday, they've already got this website set up. And for those who have registered already, there is no need for them to repeatedly register. But for those who have done their RAT test and they have not yet registered, then they can make use of the new platform to do the registration, so that the CHP will have a better understanding about the trend of the epidemic. But of course, under the new guideline, if that person who has had 2 jabs and on the 6th and 7th day after they have done this self-RAT test, and if they have been tested negative, then they can deem it to be that they are already infection-free, and therefore they can go back to the community and resume normal life. So for those who have had 2 shots and for 2 consecutive days, if they have been tested negative, then they can deem it to be that they have recovered already. We understand that there are many voices in the community, whether it's through the SWD, the HAD, and also all the HA hotlines. There are difficulties for people to get through. And I understand that recently, the GCICO is looking into how we can increase the capacity, because we understand that with that platform set up, there'll be more reported cases and we'll need to have more resources available. So I understand that they are preparing for the increase of that capacity. That is the capacity of the hotline. Well, I might as well make it clearer. Well, according to the CHP, they have told my colleagues that yes, the interim housing has got occupation permit, but then to them, it's still very much a construction site and nobody is going to test the sewage sample. So that might be a loophole. You will have to do more coordination. I've already taken the initiative to inform the THB and they are fully aware of that. Well, let me supplement on sewage sampling. Well, it's done by the ENB. I can pass this on to the ENB. Well, you will have to coordinate, not just passing the message, because at the end of the day, it's about how the epidemic is developing and it's about treatment. So it's not about giving feedback to the Bureau. You need to do coordination. We have to have a centralized authority so that you can follow up and then you can tell us what we are expected to do, because what you've been doing has been very piecemeal. There has been no overall coordination at all. Next, Chen Hoyan. Chen Hoyan. Yes, I'm here. Madam Chair, can you hear me? Yes. First thing is, other than this legislation and the subsidiary legislation, there are a few things that I'd like the Undersecretary to explain. That is for the FHB. You talk about coordination between different bureaus and departments. But then what we find to be difficult to understand is that there are non-infectious patients in hospitals. They are staying in public hospitals. In fact, they can be transferred to private hospitals. But how can that be done? How come it's been so slow? And what we'd like to know is that there can be designated hospitals that can admit more COVID patients. And yet we have not been making very good use of the hospital beds. And also for the for the mobile cabin hospitals and the isolation facilities, some people should be leaving or they should be discharged, and yet they have not received any professional doctors signing the documents so that they can leave the isolation facilities. So there are beds and vacancies that can be vacated for those in need. So the flow has been very slow. So where is the bottleneck? Why is this taking place? And last week, I've repeatedly asked this question. That is for the hotline, the helpline. All right, whether it's run by the FHB or the HAB. So the hotlines offering help to the citizens are simply not adequate. Last time, we already asked you to increase manpower. So have you got any concrete plans to increase manpower? And also there are people who have been infected and they're staying home and they're very weak. And Undersecretary, at your opening statement, you said that that should be very short. But then will there be drugs available? And can some hospitals under the HA dispense some antipyretics to these who are having fevers? So that's very needed because you have not been able to resolve the problem. You just said that that should be short-lived. In fact, this week's situation is very much the same as last week's, if not worse. Thank you. Thank you, Madam Chair. With regard to the HA and other private hospitals, in fact, there has been some agreement for transferring some non-COVID patients who are not acute patients to the private hospitals for treatment. And of course, in the process of the transfer, the medical teams, whether it's from the private sector and the private sector, there needs to be communication as to who would be transferred and what should be done and in what circumstances should they be transferred back to the public hospital. So sometimes it's a hard decision, and therefore the HA will definitely try its best to make the best use of hospital beds available in the private sector. So they will continue to work hard to make the best use of those beds. With regard to healthcare or medical facilities, I understand that there has been feedback saying that whether it's the 6th or the 7th or the 8th day, so long as they have completed that isolation, the flow should be completed. But then because of some communication problems at different areas, in particular in Penny's Bay, there are many people there. And during the peak of those days, there might have been some delays in completing the process. But then as soon as we are aware of that, we will take appropriate action so that they can be, we hope that they can be discharged early. And we have already answered a question relating to this. I understand that well, sometimes departments have set up hotlines and still they have been overloaded. So as soon as the platform has been rolled out, there are many calls, and we are still in the process of doing the registration, and therefore the demand is huge. So whether it's the HAD's hotline or the SWD's hotline, they are increasing manpower, and they're actually increasing the number of lines available so that they can deal with more calls. I understand that they are doing it already. And we are also making preparation to further increase the capacity. With regard to dispensing of drugs, sorry, I'm not coming through. Can you hear me? Yes, you're coming through, it's okay. And on dispensing drugs, on antipyretics, yes, the DFH has explained that there is huge demand for such medication. And yet what they are advising is that it should not be confined to a particular brand or a particular kind of drug. In fact, there are different proprietary drugs available, Chinese or Western. So long as they are manufactured in Hong Kong or elsewhere, well, so long as they have certain ingredients, that can also be considered. So that's one way out. And also, different views were given last time. For example, for different drugs or medicines for oral drugs or cough medicine and so on. Well, they might be suitable for certain people, and then for adults, they can take the tablets, and then for children, they can also take the syrup form. and therefore there would be a greater variety of drugs available in the community for their use.
13 members have already asked the first round of questions. For the second round, each member will have 2 minutes. So I hope we will be able to deal with the regulation. You may have follow-up questions when we come to the regulation itself. Also, I believe we need to call another meeting. I think the situation is developing rapidly. I hope that the government will. Well, I think it is our target that before Thursday this week, we can call another meeting so that we can, stick to our agenda. 2 minutes for the second round of members. Mr. Michael Teen. Thank you, Madam Chair. Undersecretary, I think you know that I am a very persistent person. The death toll every day involve mostly elderly who have not yet been vaccinated, living mostly in elderly care homes. I just ask you to persuade all the elderly to take 2 jabs of BioNTech. This could be done within 3 weeks. This is better than taking 3 jabs of the coronavirus, and it takes 1.5 months. All experts agree to this. But you're saying that, BioNTech and coronavirus are not very much different. But 3 weeks could be a matter of, life and death. I'd like to ask again, why is it you do not try your best to persuade them to take 2 BioNTech jabs? Many experts are telling us that there's not much difference in terms of risk, but it's a lot faster in the case of BioNTech. Regarding the distance between the interval between the first and second jab, the advisory expert panel said that even for coronavirus, the 2 jabs could be taken within 2 weeks. But coronavirus takes 3 jabs for BioNTech, it's 3 weeks. And to understand, the second reason is that according to many medical experts' observation, after one has taken the BioNTech vaccine, many people tend to have more, side effects like, fever, tiredness, and so on. For the elderly, especially those who are frail, they may have symptoms which ordinary people would consider mild, but it would increase the concern of those who take care of them. There is no basis in what you are saying. All the experts agree that they recommend BioNTech. Undersecretary, I don't think we should compare BioNTech and coronavirus. I think later on, if there's an opportunity, you can further explain to Mr. Michael Teen. The message is very clear. But the point is that every day we have more people, we have new infections. We need to save lives every day. If we could save one day, that could make a difference of more than 100 lives. And we're talking about people of different age groups here. Elizabeth Kwok. Thank you. Madam Chair, first of all, I'd like to thank the frontline medical staff for taking care of all the COVID patients who have been infected, whether it's the staff of the elderly care homes and also our frontline, staff. What I want to say, I think we had a meeting last week. We asked many questions. We made many suggestions. We're not blaming anyone. We want to boost morale so that everybody can do a better job. But when the frontline staff seeing that people are so worried, we see, people dying every day. Staff in the elderly care home are crying and telling us they don't want to see the residents die. We've seen the confirmed patients committing suicide. We've seen children dying. We really would like to help the government to resolve the problem ASAP. But after the meeting last Friday, we made so many suggestions, but I don't see today in your written reply or the reply by the Undersecretary that you have really resolved the problem. We're telling you that people cannot buy the antipyretics in the market. We told you about this last Friday. How much longer do you need to look into that? The problem is still not yet resolved today. People still can't buy that. All the proprietary Chinese medicine have been distributed. There's no more. So where have they gone to? You say in the public hospitals, you don't use Chinese medicine. Where have all these Chinese medicine gone? We like to help the citizens, but we're not able to. There are beds in private hospitals. We told you to move the patients to the private hospitals, to requisition the private hospitals. You say you take longer to consider that. I don't think you have the luxury of time here. I don't think you should, try to procrastinate. We're trying to resolve the problem. We want answers. We want you to do better in terms of internal coordination. Do not work, in a silo. We're all working together, trying to save lives. We're all very upset. We have already repeated ourselves again and again. If you're not fully prepared, if we had another meeting this Thursday, you give us the same answer, telling us that you're still thinking about everything. And meanwhile, there's still no antipyretics in the market. How can we be accountable to the citizens? And you're not giving us any numbers either, Ms. Kwok. Well, we will be looking at the provisions of the regulations in a while. I think they are just paying lip service to electoral members. They're also doing that to the citizens. I think we've been saying this all along, and we have to keep repeating this. I think we are talking about the lives of people here. If they continue to procrastinate like that, there's still many people who could have been saved. We've been saying all along the same point, and we hope the government can hear us. I don't think the confirmed residents in elderly homes cannot be asked to stay in the elderly care home anymore. Undersecretary, to answer your last question as to whether more facilities could be used to accommodate the elderly residents of the care homes, I have already explained earlier that one of the hardwares we are working on is the cruise terminal. Some hardwares are being built there in preparation for admitting the elderly, which the elderly care homes cannot accommodate or admit. As for medicine, we are very concerned as well. We definitely will approach local pharmaceutical companies and overseas drug manufacturers to help. And with the support of the central authorities, we would have asked for the mainland to supply materials, including medicine, to Hong Kong. We are steadily asking for assistance from the central government. Mr. Wong Yun Shan, 2 minutes. Undersecretary, I'd like to follow up on the question regarding the care homes. We have 160 people dead today. 4 people have died before they reach hospitals. The homes is, a disaster area. So this Undersecretary, there are 74,000 people living in these elderly care homes. Of the 74,000, do you know, Undersecretary, how many of them have already been infected and found positive? How many of them have been tested positive? And how many amongst them will need to be hospitalized? But because the 8,000 beds are already occupied, they're not able to admit it, and they're still waiting in the care homes. 4 have died before they have can be hospitalized. Secondly, although you've announced that the second and third jab, the interval between them could be reduced from 6 to 3 months. According to your latest guideline, you have not updated that guideline. So how long do you have to wait to do that? Earlier on, you said that after some people have taken the first and second jab, and they cannot wait any longer. Before they can wait any longer, people have died, even before it's time for them to take third jab. Undersecretary. Thank you. Regarding the vaccines, I think we already have published a press release regarding the recommendation of the advisory panel. That is for the different age groups, shortening the interval between the second and third jab. For people over the age of 60 and young children, where the vaccination rate is lower, they have already announced. Yes, you've made the announcement. Please also go back to your website. You'll find that people cannot register. The website still do not allow people. If they don't have an interval of 6 months, they will not be allowed to take the third jab. Many of my doctor friends have not received a guideline telling them that they can do this. The government's guidelines have also not been updated. I think this should be the responsibility of your bureau and the Department of Health. Department of Health? Are you aware of this problem, Madam Chair? On the vaccine website, if you want to make bookings for vaccination, the priority is that for those over 60, they can make booking 3 months in advance for vaccination. For those below 60, meanwhile, the booking system will not give them the priority. So if you're 59, you still have to wait for 6 months. Priscilla Leung already said that I don't understand why you can't shorten that interval so that everybody can be vaccinated earlier. Even for private practitioners right now, they cannot vaccinate these people. Regarding the arrangement for the third jab, for normal people, there's an interval of 6 months. Elderly, only 3 months. For some people, if they have particular needs, for those working in high-risk professions, or if they need to travel abroad, under the current policy, they can walk in to the vaccination center and take the jab. For the private medical practitioners, because of the constraint of the online booking platform, for those over 60, I think they can get vaccination if they go to the private clinic. For people with particular needs, if they need to be vaccinated before 3 months of expire, they can also get a service from private medical practitioners. Well, I think you need to conduct more public education. Thank you. Regarding the isolation order, the Department of Health talked about saying that people can be deemed to have complied with the order. I'd like to tell to the Undersecretary that we're talking about an order, an isolation order. You cannot be, ambiguous. People need to comply with the order. If you're so ambiguous, then don't tell us about penalties. You want to punish people, you need to be precise. You cannot be ambiguous. We're talking about the Hong Kong government. It's not a government that is so ambiguous. And also for self-testing and the reporting platform, what is the legal basis? I've read CAP 599. I might have missed this one. Could the DFJ tell me? I've read 599A, 599J. Nowhere do I see that there is a legal basis. On 7th of March, you publish a notice telling the public that the center encourages people to report their cases. Why are you talking about encouragement? People are dying. You must have a legal basis. You must tell the people that they must report the infection so that we can have the accurate numbers. We're talking about human lives here.
Undersecretary. Thank you, Madam Chair. My understanding is that with regard to the isolation orders, well, through the system, once they have reached the 6th and 7th day, and if they have 2 consecutive days of negative report, then they can just be discharged from the isolation order. So that's what we meant. Can the DFJ colleague answer the second question? Yes, DFJ colleagues, please be simple. Do we have the DFJ colleagues here? What I'd like to say is, well, the next one then. So Ms. Kong, just jot down your question. We'll see if they can come up with a reply. All I'd like to say is Hong Kong people are very law-abiding. So they be prepared to follow the clear instructions from the administration. Okay, if it's mandatory reporting, then they'll report. But then if they just allow them to do whatever they want, then they'll just go out. So even for very knowledgeable people, they think that so long as they are fully masked, it's okay. So even if for those with 2 masks, they still get infected. So the law has to be clear. You have to let people know, and then they'll follow. Hong Kong people are law-abiding. I trust that, but then you will have to make sure that you are clear and precise. Next, Ms. Kan Wai-man. Thank you, Madam Chair. Madam Chair, my question is about 241N. That's about the ERO. This is a very important question. So in invoking this, you're doing this by way of negative vetting, and we are scrutinizing the legislation here. So the law gives very clear power to the administration and is very broad. But then in responding to our letter, we asked the Secretariat to draft some questions, asking them to reply. And the Bureau said that, well, 241N is to enable the government to roll out the anti-epidemic measures supported by the central authorities. That's the reason why they have invoked this legislation. So the public and the private sectors will have to collaborate. So for private hospitals, the approaches might be somewhat different. And also some volunteers can also go to the front line. Well, yesterday, the Chief Secretary for Administration already promoted that volunteers should come in to help. And the scope is very broad. So can the DFJ or our legal advisor help? So what are we scrutinizing now? Is it a very broadly drafted legislation that can help us prevent and treat this COVID situation, taking into account all the factors? In other words, everything can be exempted. We don't want to adopt a straitjacket approach. We don't want to limit ourselves because the central authorities are helping us. Are we restricting ourselves so that outside of that scope, we cannot do anything at all? So can we have a DFJ colleague answer the question? And Undersecretary, what's your understanding or what's your take on this? Are you able to answer the question? Hi. Yes, please. Under 599A, Section 32, well, if there is risk of infection in a community, then there is a criminal liability. And then for the report duty, well, Ms. Khan was asking about the ERO, the scope of that authority. Well, for that, I have to defer to another colleague. So that colleague is answering the question raised by Ms. Kong Yok Foon. Yes. Yes, my apologies. I'll defer to another colleague to answer the question. Yes, have you completed your reply to Ms. Kong Yok Foon? If not, then please go on. I have nothing further to add. Thank you. Okay. Thank you, Madam Chair. Concerning 241N, Cap 241N, well, the power to grant exemptions, well, as the Bureau said, is for the purpose of preventing and also for the prevention of spread of the disease. And then our powers can be exercised under that law. And also under Section 2.2, there are a series of factors to be taken into account. So that would be subject to Section 2.1 and 2. In other words, it's not confined to the support from the central authority. So long as you can meet the requirements under subparagraph 1 and 2, you can do whatever you need to, right? Yes, correct. Madam Chair, in fact, under that piece of legislation, the CS4A, after invoking that piece of legislation, will he be making announcement to the public explaining what he has done under 241N? Well, at this meeting, we don't really care or mind that they have invoked that piece of legislation. We are bothered because they have not been using it properly. And we'd like to know exactly where they've been invoking that law and where they have been using that power. For example, in the Loop area, the temporary bridge, and also for care homes, they don't have to use the original license to segregate those who have been tested positive and those who haven't. So other than that, can you explain to us how you invoke that 241N? Anything else from the DOJ? Thank you, Madam Chair. On the granting of exemption under Section 2(1) of the law, it has to be in writing in granting that exemption. In other words, for any exemption that is to be granted, it has to be in writing instead of just doing it verbally. Okay, it's just about the format. So just now is Ms. Kan Wai-men. We are concerned that even with the law here, you have not been able to make use of it. In fact, you've been given that lifeline and you should have used it properly. So at this juncture, we hope that you can make better use of it, because there are many things that you can do under that so that you can do it in order to fight the epidemic. You should not be straitjacketing yourselves. And as a result, you're not able to do many things. In fact, the ERO is there to save you at critical times. So that's the view that we'd like to give you. Next, Mr. Chiu, Mr. Deacon Chiu. Okay, before that, I'd like to extend the meeting by 15 minutes using my power as chairman of the subcommittee. Mr. Chiu. Yes, I'd like to talk about the care homes and also the elders, because as many colleagues have touched on that, this is something that cannot afford to be further delayed, because as one more day passes by, we have more deaths, and many good ideas have been brought up, and I'm in favor of that. There needs to be better coordination, because we have received many complaints, and I personally have received complaints from care homes. There are confirmed positive staff, and they will have to take care of elders who have been tested positive, and they are most worried that some of the staff might have to be isolated and there'll be nobody working at the care homes. And for those of us working on a team to support Hong Kong, Mr. Leung, who is the leader of the team, we have been talking about this. And on vaccination, we will have to deploy all the resources available in order to go to the care homes to do the vaccination. So when will it start? Well, Dr. Lam Chit Yun has already asked many private doctors to help, but then can we mobilize the entire community's resources? For example, I understand that the DOH and also others have been helping. And what about the nursing college? So there are people who are knowledgeable, and when can they come in to help? Undersecretary. Well, I'd like to defer to the DOH on the vaccination program. Thank you, Madam Chair, and thank you, member. Well, for the care homes, the vaccination services cannot afford to wait any further. In fact, for the vaccination program, well, starting from middle of last year, we already started that, and by the end of this year, we already invited one more medical group to help us to do the job at the care homes. And other than this, we also have more than 150 private doctors who provide visiting services so that they can also do vaccination for the elders in the care homes. In fact, other than the 5 medical groups, we have also organized 9 new teams. And they also include what you suggested, for example, for those practicing in the private sector and also private doctors who have been recruited earlier on. They have joined teams to provide the service. What about the Red Cross? Well, Red Cross, they have not taken part in this initiative. Okay. Next is my turn. And I'd like to say this. Well, for the ERO, please make good use of it, because what is most pressing is about healthcare professionals. We need to have enough numbers, whether they are from the mainland or from the private sector. Well, just now we counted the numbers. In fact, we don't need to know how you do the coordination internally. What we need to know is that the government has been doing the coordination so that everybody that can help can help. Then we haven't seen that yet. You haven't really rolled that out. That's the duty of the administration. And once again, we are actually doing a catching up game. All right, you said that in the 3rd week of April, what are you expecting to happen? How many people who should not die might die? And how many people who should never have been infected might get infected? We have to control the situation. Can you give us some numbers? What are your projections? You have to do it, or else by the 3rd week, it's progressing every day. So how many more staff do we need? How many more beds do we need? And how are you going to divide the work? We don't need to know the details. I just need to know the numbers. How many more hospital beds? How many doctors and nurses in the private sector can be mobilized? How many from the mainland can come over to help? You will have to have a division of labor because we are helping to save lives. We'd like to reduce serious cases and also mortality rate. That's the most important task before you. So Undersecretary, please listen to us. Please hear us loud and clear, because in answering the questions, you haven't been able to come up with an accurate figure. You haven't been able to tell us exactly how many more patients you're expecting. That's what I'm most worried about. Undersecretary. Thank you, Madam Chair. Thank you for your comment. We will go back and try to come up with more information. Because you haven't been able to address our questions, then how can you reassure the public? So one more thing that I'd like to say. In fact, we are in the same boat and the public are the same. So this is something that we'd like you to know. We are not on opposite ends. We are hand in hand in the same boat. I hope that you can get that message. We don't want to see more people sacrificing. Second round. I think all of you have managed to ask questions already. Well, I can see that Ms. Kong Yuk Foon, you'd like to ask in the 3rd round, right? Okay, just 1 minute, please. Thank you, Madam Chair. Well, after listening to the DFJ, they referred me to Section 32 of 599A. That's not applicable. I don't need her to explain again. Well, Section 32 doesn't apply to the self-testing and also the report platform. The reason why I asked this, because we are talking about a society that is run by the rule of law. And if we ask people to do something in order to make sure that the figures will not grow any further, then we have to have very clear legislation. And if we have a golden key, then you can use that key appropriately. Well, the reason why we have been grilling you, that's because I like to have a legal basis for whatever we do. And if we are going to punish people, then I'd like to know the legal basis for that. Okay. DFJ, anything that you'd like to add? No, nothing to add. Because as I said, under 599A, Section 32, well, for people who fail to report, and if that resulted in the public being infected, then he might be caught by Section 32. Other than that, I have nothing to add. Leung Chi Wing, who hasn't asked in the 2nd round, and then after you've asked your question, then we'll move on to the cross examination. Yes, Mr. Leung. Thank you, Madam Chair. I'd like to ask about the isolation order. I have to help the workers and also the salaried people, because before the 26th of February, you have this online application form for COVID patients, and many people have been tested by the community testing centers, and they have not received the report, and they only received the report after 7 days, and then they try to report it online. Taking myself as an example, on the 21st of February, I did a test, and then I only received the result on the 28th, and then I reported that afterwards. So for these people, they are working class. So when can you give them this isolation order? When can you give them the sick leave certificate? Because by the 28th, like myself, there is no information, and by now it's already 14 days, and many of them have recovered, and yet they have not got the sick leave certificate, and they have not been able to go back to work because their employers simply do not allow them to go back. So when can you issue them with the isolation order so that they can get the sick leave, and then they can also resume work? And also the figures that we asked for have not been available. For example, on the online application forms, how many people have reported and how many family members are involved and how many people have been sent to the isolation facilities. So can you tell us that? And also yesterday, you also started the rapid test positive result reporting website. How many people have reported and also how many family members are involved? Can you tell us? And also on the hotline, 1-833-019, how many staff are manning the hotlines and how many calls have been dealt with? And also the number of people calling for help. Can you tell us?
Undersecretary, the first questions about the sick leave certificate. Perhaps the Department of Health can further supplement. Thank you. As I said, the Labor Department, after amending the employment ordinance, will introduce a new provision to the effect that all employees who, because of Cap 599, are not able to leave certain premises to go to work, then he can lodge a claim. So the amendment has already been gazetted. I don't think that's the question I asked. I'm asking about people before the 26th of February, those people who have reported through your system, the people who've already taken tests at the community testing center, they still cannot get a sick leave certificate or a community isolation order. I'm not asking about the amendment of the ordinance. Well, regarding the question you asked, I've already answered that earlier. Before the 26th of February, if the person had announced that he's tested positive, we have an established procedure in place. We will issue immediately, isolation order to them according to the address he or she has reported to us. How many people are involved? Do you know, Dr. Kwong? I don't have the numbers of it. You don't have any numbers at all available. How are you able to help the people? You have tens of thousands of employees waiting to get the sick leave certificate in order to get the allowance. I think Ms. Leung Chi Wing's question actually reflects the fact that we have yet many questions we have to ask. So I hope the government can really go back and really, reflect on all the things that members have put to you today, and you have to answer all our questions. We want to work with them. We also hope that no one else will die any further and no more children will be infected. You ask members to be on your side, then please improve the mechanism for coordination. Otherwise, it's not reasonable for you that when we see so many loopholes in your effort to curb the infection and we don't say anything. I don't think we will do that. All members would like to support the government to fight the epidemic. We have pointed out all these problems. What I hope really is coordination is the word. We want coordination. We want you to have exact or precise numbers before we are convinced that you'll be able to help the public more effectively. As the chair of the subcommittee, I have to say that if you want us to be on the same side as you, you really have to, be able to, save and help the public. We want fewer people to have to die because of the serious infection. If there's no improvement to the situation, of course, we'll continue to speak out. We must continue to speak out so that they will improve the policies. But with that, we will now move to the clause by clause. Our policy discussion now is over. So on Friday this week, or rather Thursday, the 10th of March at 10:45 to 12:45, we will go to the clause by clause stage. Whether it's the DOJ or the undersecretary has heard new suggestions from members and questions which we've asked many times already. Why is it that people are not able to, call, you're not able to answer the calls and so on? If you're not able to answer the questions, I hope you will give us a written reply for follow-up. The Health Services Panel at 10:45 Friday this week will convene a meeting as well, and members can also follow up on these same issues at that meeting. If, like the last two meetings, if we're getting the same answers, I think I would like to say that the public will be very worried. So will we be worried. We will need to continue to follow up on this issue. I think today we are already, it is now already 6:37. So I will not go into the first section of the clause by clause. So on Thursday at 10:45, we will go immediately, scrutinize the English and Chinese version of the regulation. If we all agree that we will now adjourn here. And to reiterate again, I hope that if the government has any new information, please give them to this subcommittee in writing, so that we can continue to follow up on the issues of concern.